If you're a bariatric surgeon, these are the only 9 categories of content you need to be focusing on in all your marketing. Now, in the context of this video, I'm talking about specifically that, making videos. I have 49 topics I want to share with you across these 9 categories. Let's get started. Number 1 is about you. You're the most important person in your practice, not your patients, because you have what they want. You're the gatekeeper. Number 1 is a day in the life of you. This is a behind the scenes video of what your normal day looks like. Number 2 is your origin story. When did you know this was what you wanted to do? Who was your role model? What experience did you go through to get here? Number 3 is right now. Do you still enjoy doing what you do right now as much as the first time that you did it? This is a before and after. This is where I started. This is my origin story. And here's the after. This is how much I enjoy it. One thing that I have on here that I'm going to talk about later is it's the power of I have the ability to change someone's entire life in one day, and it never gets old. I wake up and I come to work every single day to help people with that. Being able to help people change their entire life in one single day. Number 4 is what have you achieved in your professional career that you're most proud of? It could be anything, including your community involvement of your practice, the patients you've helped, awards you've won, publications you've been featured in. Number 4, what have you achieved in your professional career that you're most proud of? It could be anything. It could be community outreach, the patients you've helped, awards you've won, publications you've been featured in, or even speaking on stage. Number 5 is what bariatric surgeries do you enjoy the most? Is it the outcome of the surgery that you enjoy, how you can help your patients, or do you actually enjoy a specific surgery doing it, being hands-on? It could be anything. Number 6 is who do you enjoy helping the most? It could be a condition, a specific person. It could be an older person. It could be a younger person. It could be parents who have kids. You can help them change their entire life so they set a better example for their kids. They're more confident and improves their whole life. It could be anything. And number 7 is outside of the practice. This includes publications, events, conferences, TV appearances, speaking on stage, or doing interviews. Number 2, your practice, why we're not like anyone else. Number 1, an open house tour of the whole practice. This is a great video where you just give someone a behind the scenes tour of the entire practice. This is our waiting room. This is where we do our consultations. Let me give you a tour of the operating room. After you're done with your surgery, we bring you into this room. It's just a behind the scenes type video. Number 2 is staff profiles. Interview every single person on your staff for a quick 5 to 7 minute video. Next is core values, then charity, community outreach, events, seminars, patient appreciation events. One of these that has a lot of potential is the events. There's a lot of practices, and I'm sure you do this, that have educational seminars or events for patients that are considering having bariatric surgery. So they'll put on an event where they come in, they give a little bit of information, there's a presentation, they give out some pamphlets, and then they have an open Q&A session. This is powerful because we can do this. We can record it, we can put the replay on your website, on YouTube, Facebook, wherever, but you can also run it as an ad on Facebook. This is powerful because you can run it as if you're considering bariatric surgery, here's a replay of an event that we just put on in our office, and they can watch it. That one event that you put on, we can run over and over and over again. Number 5 is the psychology behind what we do, the why. It's about the mobility and quality of life of someone. It's a total transformation of their entire life. You're totally changing someone's outlook on their entire life by changing their outlook on themselves. Now, the most important relationship that we have in life is the relationship we have with ourselves. In one single day through one of these surgeries, you can help them completely change the relationship they have with themselves. So it's obviously the very physical change that someone has after one of these surgeries, but it's also the mental, the psychology aspect. So I like doing psychology type videos also, not just the physical benefits, but also the emotional self-confidence benefits. And number 6 is safety protocols. So many practices talk about how our safety protocols are our number 1 priority. Safety is our number 1 priority. Do another video on this. Take them behind the scenes. Say safety is our number 1 priority. So I want to give you a tour behind the scenes of what that means. Here's where we clean our equipment. Here's the procedures that we have in place when we do an operation. Here's how I get cleaned up before going into an operation. Here's what we do after the surgery to make sure everything heals so there's no infections. We minimize scarring. All these things. One of my favorite things about these videos that we'll create is you're showing someone, you're not telling someone. And that really is one of the cheat codes of marketing, is it's not just telling someone something, it's actually showing them it. Number 3 is profiles of your patients. This is a type of future pacing. If you're in this specific situation, I want to share a story about someone who was in the same position that you're in right now, and this is where they're at now. This is a type of underdog story. Now, in any of the marketing that you do, one of the most powerful things you can have is a story. It's the number one most compelling, most persuasive type of marketing you can do. What it is it's really a mirror. You're mirroring someone. You have someone that wants to have a certain outcome, that wants to have a certain body, that's struggling with something right now, and you're showing them someone that was just like them. That's the power of it. And the most powerful story of all is the underdog story. So that's what we do in number 3. You could do review reaction videos. So we print out a review and you give some commentary on, oh, I remember this patient. This was Jack. He came in, give some profile of who he was, what the procedure was, how that went, and how he is now. So it's the before, the after, but most importantly, the entire process. Next is patient profiles, like I mentioned earlier. Before, procedure, after. This is the if-then. If you're experiencing this struggle, then I want to share with you someone that was in your specific situation. And you show them. You talk about it for maybe 5 to 10 minutes. It's really powerful because it's a story. Number 3, top 5 patients. Maybe these are your most memorable patients. Maybe the patients you're most proud of. Maybe the patients that overcame the most amount of obstacles. It could be anyone. The way I like to create this one is I just think, who are your 3 or 4 most recent patients that were your favorites? Immediately, there's going to be a couple names that come to mind. That would be a great basis of that type of video. Number 4 is, what have you learned from your patients? You've grown through them. It's a two-way relationship. The beauty of me as a bariatric surgeon is most people think it's a one-way relationship. I help someone with the surgery. They obviously, their life has changed, but I get as much out of them as they get out of me. This is a two-way relationship. I've really grown and it's impacted my life, and they've grown and it's impacted their life. So that kind of, mutual relationship type content. And number 5 is long-term patients. I call this the after content. So 3, 5, 10 years down the road. I'm going to talk about one later, but when you look at these patients, I think one of the biggest concerns that they would have is, what if it doesn't work? What if 3 years from now I'm back to where I am right now? The power of this type of story, this profile of this specific patient, is you can say, here's someone that came in 5 years ago, and this is how their life has been completely transformed. I mean, this is just a random example, but you could say, Mark was 55 years old when he came in. We did this surgery for him. He's 60 now. 55 to 60 have been the best 5 years of his entire life. So it takes out that concern of, well, what if things don't really change? A lot of your patients, and I'm jumping a little bit ahead of this, I'll talk about it later, but a lot of your patients are going to be thinking, I've tried a lot of things. I've tried pills, I've tried this, I've tried that diet, none of it worked. They're skeptical, they're nervous, they're afraid. By doing this type of content, the longer term patient type content, these patients that you've helped 3, 5, maybe even 10 years ago, is really powerful because it shows them it does work, and here's how it'll work down the road for you. So that's where I really like that after type content. The next one is what I call the 4, 5, 6, 7 sequence. This is the middle group of content that we're going to be creating. So this is from their initial consultation all the way until after surgery. Number 4 is your initial consultation. So this is based on all your consultations that you go through. Now, obviously, a consultation is something that's one-on-one with a patient. There's a lot of specifics that you talk about just with them, but we can make a more generalized video. Say, these are 10 of the most frequently asked questions that I'm asked on a first-time consultation for this surgery or for that surgery, getting specific to that type of thing. It doesn't have to be exactly specific because it's impossible to be that, because you don't know, when you're in a consultation with a patient, you know a lot about them. There's things that you recommend. You have a certain level of knowledge about them, their body, their goals, what they've tried in the past. So it's a lot more specific. But this one here is cool because instead of like a 60-minute consultation, it could be a 20-minute consultation video. Number 2 is, how do patients prepare for surgery? Number 3 is most common consultation questions answered. I mentioned that one earlier. Number 4 is preparing for surgery from your perspective. I'm a bariatric surgeon. Here's how I prepare for your surgery. Let me take you behind the scenes. This is a great video that you could send out for your patients before surgery, maybe the day before. Say, this is what we're going to be doing. I wanted to give you a little bit more clarity. With all this content that we're creating, that's the word, it's clarity. Show, don't tell. Anything you can do to create more clarity is going to create peace of mind. It's going to relax them. It's going to put their mind at ease. It's not the unknown. It's not the what if. It's, aha, I'm still nervous. Of course, they're always going to be nervous. This is one of the biggest decisions they're going to make in their entire life, but they have a lot more clarity on what's going to be happening, and that's the power of these type of videos. Number 5 is how each surgery is customized for each patient, like gastric bypass, gastric banding. You have a specific surgery, but there's only a certain percentage of it that is kind of standard. The rest of it is customized to your body, to your goals. I'm the expert, obviously I'm the surgeon. I talk with you, I discover your goals. These are what options, this is what I recommend, and here's how I customize it. A video about that. And then lastly, damaging admission copy. Damaging admission copy, those 3 words, are the most powerful thing that you can do in any of your marketing. And it's not just videos like this, any of your marketing needs to have it. Now, really what it is it's saying who it's for, who it's not for, who it would be a good fit for, who it won't be a good fit for. You and I know nothing's 100%. You have patients, maybe it's 1 out of every 10 patients that comes in that you say, I don't recommend this for you. I don't think it would be a good fit. So talking about the pros and the cons is the easiest way to increase trust through these videos. I love doing damaging admission copy because patients are afraid, they're scared, they're nervous, they're skeptical. This addresses all of that. Here's what you need to know. Here's what you need to consider. Here's who it's good for. Here's who it's not good for. Here's a patient that came in and I recommended that they don't get the surgery done. Here's 5 reasons why. The easiest way you can increase trust in your marketing and allow your patients to stop being skeptical. Doesn't matter what your track record is, how many reviews you have. People are just naturally skeptical, always. Doesn't matter what they're buying, especially something as big as this. One of the biggest decisions they'll make in their entire life. That damaging admission copy works really well. Number 5 is your surgeries. The how. What are your top surgeries? Gastric bypass, gastric banding. You can do a versus comparison. Here's this surgery versus this surgery, or this surgery versus this surgery versus this surgery. Here's some things you need to consider. I have a lot of people that ask me about what's the difference. I'm going to share with you what the difference are between these 2 surgeries or these 3 surgeries. Get specific and do a comparison. Number 3, the surgeries explained, a walkthrough behind the scenes. I look at these as mini documentaries. It's a 10-minute video from initial consultation all the way to the end. It's a documentary saying, hey, if you're considering this type of surgery, then I want to give you a behind the scenes of exactly what it entails. More clarity. Next is show the OR, show your tools, show your surgical instruments, create more clarity. I'm going to keep saying clarity because it's so important. That's the power of these videos. That's the power of all this content is you're allowing them to get peace of mind. They're always going to be stressed out. They're always going to be nervous. But if they're at like a 9 out of 10, it brings them down to maybe a 5 out of 10. Number 6 is your equipment. That's kind of what I mentioned earlier. You get to show off your equipment, the operating room, don't tell, show, what I mentioned earlier. One of the most powerful things you can do to grab attention, keep attention, and persuade people is something called physical headlines. So instead of just talking like this, like in a written, let's say an article on your website, we take it one step further by turning it into a video. They see you, they hear you, they build an emotional connection with you. The next step you can take it is through physical headlines, which are props. What I've got right here is a prop. This is a prop. My notes here are a prop. When you show them, it creates more clarity. And number 7 is your post-surgery process. I would say of every piece of content that we could create, this would be the most important one of all. The psychology of a buyer, no matter what they're buying, whether they're buying a car, a light, a phone, they're always thinking, I've bought stuff in the past, I've wasted a lot of money in the past. I didn't get the outcome that I wanted. I regret it. I never hear the end of it. Now, when we talk about this surgery, like I mentioned earlier, this is one of the largest decisions they will make in their entire life. It's one of the most consequential decisions, and it's one of the best decisions they'll ever make in their life. But talking to the post-surgery process allows them to get clarity. And the thing about it is most people are going to jump to the absolute worst case scenario. They're going to think, oh, it's going to take me 9 months to recover. It's going to take me a year to recover. I'm going to be in pain. All these extreme things because it's very high emotion. Number 1 is how do patients recover after surgery? Number 2, the most common recovery questions answered. Number 3 is what post-op timeline looks like. 24 hours after surgery, 36 hours, 72 hours, 2 weeks, 3 weeks, 4 weeks, 2 months, 6 months. Here's what you can expect 6 months after surgery, and do just an itemized list where you go through it. This is the day after surgery. This is the week after surgery, the month after surgery, 3 months after surgery. Thing about this one is they're always, like I mentioned earlier, they're always going to jump to the worst case scenario. And you and I know it's never extreme as what they think up here. This is a scary thing. This is the biggest driver of emotion and fear that they have in their entire body. So talking to this, creating clarity on what it looks like after surgery will really minimize a lot of their fear. Next is a behind the scenes of recovery, immediately after surgery, pain management, bruising, scarring, infections, activities to avoid, diet, nutrition, hydration, things to watch out for. An entire video just about you've just had the surgery, here's what to expect. Here's the diet, here's the nutrition, here's how you need to stay hydrated, here's things you can do to minimize bruising, to minimize scarring. You can still be active, but you need to be very careful. You don't want to lift too many heavy things up. That type of video. You know better than me, but just the normal conversation that you would have afterwards, the itemized list that you would send home to them, turn it into a video. Number 5, back to 100% timeline. Most people think that it's going to take a year or some extreme amount of time for them to get back to normal. This creates clarity on that. Next, how to emotionally cope with surgery. We talked earlier about the physical changes you're going through, but the psychological changes are, in many regards, more intense than the physical aspect of it. Next is anesthesia information, and finally, nutritional guidance post-surgery. We're not just here to give you the surgery and be done. We're here for you now and into the future. Here's all the additional resources we give you. Here's a bunch of information I want to share with you. That type of piece. Number 8 is your most frequently asked questions and lists. Most common general frequently asked questions you get, but most common frequently asked questions you get about a specific procedure. So you have general questions and you have specific procedures. And then you could take it even one step further. Specific procedures from people who are over 50 years old. Specific procedures from people who are parents. That's a consideration. I have kids. I'm going in for surgery. I'm nervous. That type of video. The more specific we can get, the better in all these things, and they pack a lot more emotional punch. Next, most common objections and excuses, secrets, mistakes, warnings, and lies. Most common myths and misconceptions. Here's 7 things that I hear that just simply aren't true, and I want to share them with you because what I've noticed is the majority of the stress that I hear from my patients is stuff that they've read on the internet, stuff that they've heard, just unfounded things that aren't true, so they should not be worried about it. And then lastly, most common things to know, watch out for, or ask. Let's say you have a patient that's comparing you to another surgeon. Whatever, that's life. Every once in a while you'll have a patient that comes in that says, I've talked to this clinic, I've talked to that clinic, I'm just kind of getting a second opinion. We know most times than not that's really indecision. They're just delaying the decision. They're nervous, which is understandable. But you can make a video like, here are the 11 most important questions you need to be asking your bariatric surgeon, and then answering them in that video. And then number 7 is financials. Total expected cost for each procedure. Cash versus financing versus insurance. When insurance will pay for your bariatric surgery. Examples. You could say something like, most people think that your bariatric surgery isn't covered by insurance, but I want to give you a couple of examples of when it is covered, and then you talk about that. Next, overseas, this is the last one that I've got, is an overseas bargain basement expose. Don't cut corners. This is an investment in your health. Don't risk it. This is a piggyback off one of the earlier ones that I mentioned, which was mistakes. I've seen a lot of reviews and a lot of videos of people that went for the ultimate cheapest option and they regretted it. They were in a lot of pain. The doctor didn't do a good job. It was a nightmare. They ended up having to get another surgery done with another doctor to get things corrected. And they're doing great now, which is the most important thing, but they wasted all this time. They wasted all this money. They were in pain. So that video is going to be like, listen, this is an investment in your health. One of the biggest decisions you'll ever make in your entire life. You're talking about the most important asset that you have, your body. Don't cut corners. This is what you need to take into consideration, and then a video about that. I hope you got a lot of value out of this. My question is now, would you be open-minded for me stopping by at a date and time that works best for you to film one of these videos with you at no cost. I promise it'll only take 20 minutes of your time because I'll show up prepared. I'm gonna write the script ahead of time based on your existing website and reviews. Worst case scenario is you get a great video that you can use on your marketing and it costs you nothing more than 20 minutes of your time. Best case scenario is you love the video, you see the value in filming more of them, and we discuss me coming in every month to film consistent video content for you and your practice. Call or text me anytime. This is my cell phone, 310-774-7311. I look forward to hearing from you, and I know that these videos would be a huge benefit to you and your practice, but most importantly to your patients. Look forward to hearing from you and filming one of those videos with you.